Sunana Ladi Matais. Na fito ne daga Borno State. Goza Lokon Government.
The little girl I am holding is a twin. Her name is Goshe. My husband married a second wife, Goshen's mother. Her mother brought her to my husband when she was pregnant. During her pregnancy, there were complications, but we didn't have enough money to take her to the hospital for proper care because my husband is jobless, so he left home. In Goshe, if you don't have money, they won't treat you. Back home in Goshe, the twins' mother wasn't going for antenatal. All they did was weigh her and gave her drugs until delivery. She didn't even do any scan during the pregnancy. No proper care was given to her as we couldn't afford it. During childbirth, the complications started again. She died immediately after the twins were born, leaving me to cater for them together with my own children. This happened around the same time Boko Haram insurgents were attacking our village, so I ran from there to this internally displaced persons camp in Abuja. Today, I see what happened to my husband's second wife happening in the IDP camp. Most of the women here don't have money, so they avoid hospitals and deliver their babies here in camp without nurses or even midwives, and sometimes there are complications. It is the same thing. We don't have money, so we can't afford proper health care.
The tragedy of a woman dying during childbirth has far-reaching impact. This does not only affect her nuclear family, but the community she lives in, works, and interacts with on a daily basis. Ladi Matthias is one out of hundreds of relatives that must deal with such aftermath. She and several others are left to live their lives not knowing the reason for their loss, let alone understand how easily the cause of death could have been avoided.
We define maternal deaths as the death of a woman during pregnancy or within 42 days of giving birth. So globally, 20% of maternal deaths currently occur in Nigeria.
And that death must have resulted from either the pregnancy directly or aggravated by the pregnancy or the management of that pregnancy. And it also has to be during the duration, and at the same time it's irrespective of location of the pregnancy. So it doesn't matter whether the pregnancy is 5 weeks, 10 weeks, 20 weeks, 42 weeks, and it doesn't matter the location of that pregnancy, whether it's in the tube, or whether it's in the ovary, or whether it's inside the womb, as far as the woman is pregnant. So if she dies in the process, then that is maternal death.
The World Health Organization defines maternal mortality as deaths occurring in a woman while she's pregnant or within 42 days of the termination of the pregnancy, irrespective of the site or duration of the pregnancy. And this is arising from causes that are either related to or aggravated by pregnancy, childbirth, or its management. And this does not include accidental or incidental deaths happening within that period.
Maternal mortality remains unacceptably high in Nigeria, the reason being that several contributing factors remain unaddressed. In comparison to developed countries, where this unfavorable epidemic has been controlled greatly, the prevalence in Nigeria and other developing countries alike continues to spread, leaving the poor as its biggest casualties.
Well, it's very unfortunate, but maternal mortality is based on different reasons. Some of them is as a result of lack of knowledge, because a lot of women, they don't want to go to the hospitals because of traditional reasons, religious reasons. Another also is lack of financing, because there's no access to adequate primary health care services, and also medical personnel. If you look at a policy that Enugu State did when they were trying to say free maternal and antenatal health care in primary health care centers, they did a statistic and they found out that it was one doctor to 1,600 pregnant women. So there's so many reasons why that is prevalent. But I think most from my own experience, it has to do with the awareness and the education and the importance of going to give birth in the hospital, because traditionally most people in rural communities don't like to go to hospitals because it costs money, and they also have their own traditional ways of doing things and giving birth at home. So those things affect the prevalence rate.
The NDHS, that's National Health and Demographic Survey 2018, puts the maternal mortality ratio for Nigeria at about 512 for every 100,000 live births. Some other estimates, has it at between 600 and 700 deaths for every 100,000 live births.
There is a relationship between the income of a particular country and maternal deaths, and that is why the high income countries, high resource settings have very low maternal mortality rates compared to very low resource countries that are economically poor, that have very, very high maternal mortality rates. I will give you an example. Finland has a maternal mortality rate of only three per 100,000 live births. While in Nigeria, as of 2017, it was 810 women that would die for every 100,000 live births.
These rates are unacceptably high. The Sustainable Development Goals targets, for 2020 is to achieve a reduction to a level lower than 79 deaths per 100,000 live births. And you can see from the figures I mentioned earlier that Nigeria is way, way, way off the mark in achieving that target. Now, in actual terms, in absolute terms, in these figures or this ratio accounts for or results in or equates about 59,000 maternal deaths in Nigeria annually. And this accounts for about 20% of the total maternal deaths globally. So clearly, Nigeria finds herself on the wrong side of a very important statistic, which of course is an indication of the level of development. It's one of the indicators, one of the indices that is used to measure development of any country.
Okay, there are multiple factors why Nigeria has one of the highest maternal mortality rates in Nigeria. To begin with, we have the highest population on the African continent, close to 200 million people. And the project looks specifically at why women are dying. Now, we look at the statistics. We look at and see that 2/3 of mothers don't give birth in hospitals, health facilities. 2/3 of women give birth in the community, and only 1/3 give birth in health facilities, which gives you an indication of the level of care that they are receiving when they give birth in the communities. As you can imagine, when a woman is pregnant, it's a 9-month period, and during that period, many things can happen. Traditionally, women should at least have antenatal care throughout their pregnancy. So the minute they get pregnant, they're supposed to go to a health facility, have themselves checked, and the progress of the baby is monitored throughout her pregnancy until she completes her 3rd trimester at about 41 weeks.
The ratio of doctor to patient in this country is about 1 doctor to 6,000 patients. And the recommendation by WHO is 1 doctor to 300 patients. Do you understand it? No, rather 1 doctor to 600 patients. UK is achieving 1 doctor to 300 patients, but here is 1 doctor to 6,000 patients. Unfortunately, most of the doctors are concentrated in the urban areas. So what happened to the village? Why do you think a doctor would want to go to the village? There is no lights, there is no good road, there is insecurity. So how is it going to work there? Our government is not developing our interiors.
There are several factors responsible for maternal death, which include the social determinant, cultural, etc. But the medical causes remain the most prominent. According to the World Health Organization, the number of maternal deaths recorded in developing countries reflect the inequities of access to good health care during pregnancy.
The medical causes of maternal mortality are not far-fetched. The first major one is hemorrhage. Hemorrhage means bleeding, majorly after childbirth.
The inability to arrest the blood loss and to correct the hemodynamic deficits or hemodynamic derangements that the blood loss may have caused is a major cause of maternal mortality. A second one within our setting is puerperal sepsis. Sepsis, in layman terms, is it's infection, right, in the course of pregnancy, in the course of childbirth, and in the period that followed afterwards. Infections arising from poor obstetric care are a major cause of maternal mortality in our setting.
Then after that, you think about something like high blood pressure. It's called preeclampsia in pregnancy. If it's not treated on time, it's going to cause maternal mortality. Then you have unsafe abortion. A lot of people are taking up abortion to terminate pregnancy. And unfortunately, we have restrictive abortion law in Nigeria. So that means that you may not have the very high quality skilled people doing the abortion. So they resort to the unskilled abortion professionals, leading to death of those people. Then, of course, there are other causes, like if the woman has a particular ailment or a disease, that could aggravate the pregnancy can aggravate. For instance, diabetes, chronic hypertension, congenital heart diseases. Well, if such people are pregnant, they can resort to death. Then anemia, malaria, HIV. These are all the different causes, medical causes of maternal mortality.
But that's medical reason. But added to that, you have to think first. When a woman is about to give birth, there are what we call the 3 delays that lead to maternal deaths. The first delay is when a woman is in labor. Does she know that this is the right time to go to hospital? And even if she's aware, does she have the resources, the finances to get to the hospital? And then, the second delay, even getting to a health facility. We know that we've had a lot of rain across Nigeria for a prolonged period of time. Some areas are really inaccessible. So imagine a woman in a rural area and the area has flooded. The road to get to the health facility is blocked. That's what we say is the second delay, even getting to the health facility. Now, the third delay, when she does get to the health facility, is there adequate care? She's bleeding profusely. Is there a doctor there who can actually realize she's bleeding? She may need a cesarean section. The baby is breaches, and the baby's head is facing up as opposed to facing down when is the normal pathway for a baby to give birth. Are they even aware that the baby is breech and she needs an emergency cesarean section? So these are some of the reasons that have added to the high levels of maternal mortality in Nigeria.
There are a lot of factors from her inherent self. When I was working in a rural area, another rural area or suburban area in this Abuja, I remember once I wanted to do a cesarean section. They refused to give me consent. And the reason was she has to wait for her husband to come to tell us, go ahead. I had to call the husband. And the husband said, he's discussing with the pastor. That if the pastor gives him permission, he will not allow me to go in. Until I threatened that I'm going to discharge them and send them away. He now rushed them. And this was about 3-4 hours difference between that time. So you can see how terrible the situation is. You don't get the situation in the educated class. Although some of the educated class are also victim of it. Because, in Nigeria we pray a lot. Everything is prayer. We're not ready to work hard. Yes, pray. There's nothing wrong with that. The pastor should be praying in the church for this patient. God is everywhere. You understand? But again, remember that I have not seen any situation where because God, you lie down and you pray and money drops from heaven. No, you have to stand up to go and work. I think the pastors need to realize that too. That while you are praying for your patient, the patient needs to seek or access skilled care for the situation.
I'll give you a story of a community it's called Jipal. It's a particular ward in Mangu local government of Plateau State. We went there. And unfortunately, when we got there, it was a little bit too late. We went there to distribute birthing kits as well as mosquito nets because we all know that malaria to pregnant women is pretty dangerous. And upon reaching there, we saw an ambulance rushing a woman and her child out of the hospital. What had happened was when they were at home, they refused to come to the hospital to give birth, and then they didn't have the blade to cut the umbilical cord, and they decided to use zinc from a rooftop, and it was rusted, and to God be the glory. The child survived, but you can imagine the agony the problems and the complications that resulted from something like that. So the truth of the matter is, like I said, the main problem is the lack of education. And another thing also is hygiene. I know a lot of people take it very lightly, but hygiene during pregnancy is very, 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 very important.
The lack of standard hospitals across the country, especially in the rural areas, has led to the establishment of primary healthcare centers across local government areas in the country. These centers have been built to handle minimal problems in communities and are only expected to make referrals to big hospitals when they are unable to handle certain cases. The general neglect of these established primary healthcare centers has sadly done more harm than good as regards to maternal mortality.
Yeah, some hospitals have systems that do not allow for prompt and efficient access, attention to patients. There's also the issue of capacity, right? The capacity and availability of healthcare workers, skilled healthcare workers to manage the care process of a patient, of a pregnant woman in this case.
In most hospitals in this environment, you lack anesthetists. And these are the people who are very vital in the resuscitation of any human being. We have to make do with nurse anesthetists. You have very few consultant anesthesiologists in most hospitals in this our environment in Nigeria, especially once you're leaving the urban area, you don't have anesthetists. The most you can have is anesthetic nurse. And as you go deeper, there is none like that at all. There's no specialist.
There's also the aspect of the attitude of healthcare workers. A recent study by the Lancet showed that a multi-country study, which had Nigeria in addition, showed that there's a very high level of mistreatment of women at the point of childbirth.
According to a joint report by WHO and UNICEF in 2017, at least 800 Nigerian women die in every 100,000 live births, with the highest maternal mortality rate recorded in the Northeast compared to other regions of the country. This report and other before have brought about several policy creation by the Ministry of Health to help contain the problem. For instance, 2013, the Ministry of Health declared that all maternal health institutions should periodically carry out maternal death review, surveillance, and response using technical guidance document as recommended by the World Health Organization. Another recent example was when the former Honorable Minister of Health, Professor Isaac Adewale, in July 2017 inaugurated a 34-member task force to accelerate the reduction of maternal mortality in Nigeria. While these policies and several others are commendable, the lacuna in the government's effort to solve this problem remains largely visible, which only means new policies must be created and implemented adequately. The need to continuously raise awareness about the consequences of poor maternal health in our country and provoke action is imperative if we want to reduce our maternal mortality rate like most developed countries. Hence, the right steps and prioritization of the problem by the government is very important.
The two things government should focus on is access to healthcare in terms of being able to pay for healthcare, and in terms of the physical access, having health workers at the clinics who are able to treat women when they're pregnant, and that way also when women are pregnant, getting them to go for antenatal care would also call for having clinics, having health workers in close proximity to every woman who is pregnant and about to give birth.
There's a lot that needs to be done. It requires collaborative and concerted efforts. There has to be increased funding for healthcare. There are certainly not enough healthcare providers in the country at the moment to help us achieve the SDG goals for maternal mortality ratios at all. So there has to be investment in improving the number of skilled health personnel in the country at all levels.
First, the government on its own have to have a good political will to understand that irrespective of whatever we are doing, the health of a nation is very paramount, And so if they have that proactive action, I don't think they will be laid back to say, let's pump money, into the health system. Remember that I will tell you, we are not expecting that government can pay for the health of all the citizens. No. But they should increase the budget while they encourage other means of financing health. For instance, health insurance. As I'm talking now, the bill for mandatory health insurance is in the president's table for assent. That is to say, everybody should take up health insurance. You understand? NHIS should be both for formal and informal sector and should be mandatory. So that way, the very rich will pay for the very poor. We are all Nigerians. We are all equal. The fact that life has favored me does not make the other person less in Nigeria. So we should pay for that, I don't mind paying for my health insurance and don't assess it if I'm healthy. And let the person who is not healthy assess it. That is my contribution to my nation. And that is how it should be. So if the president have that good political will, let him put assent to that bill and let it become a law so that everybody will be treated without having to spend so much from their pocket.
You see, I have a different approach and I have a different opinion. I don't think it's a policy issue from my own point of view because, like I said, the federal primary health, the National Primary Health Care Agency has tried as much as possible to make antenatal care free. It's tried to make coming to hospitals free. They tried as much as to build what they can with the resources available to them. Government cannot fund everything that we need for healthcare. They need to allow for investment into the country in healthcare. Medical tourism, India has done it. A lot of us are carrying our monies here, changing it to Forex and taking it to India. Why don't we if we have the facilities here, it replicates. It brings foreign exchange into the country as well as the right facility to be able to drag people into the country as well.
Yes, the government has a role to play in terms of ensuring that every Nigerian woman who is pregnant has access to healthcare and can pay for her healthcare. But even us as Nigerians in our different communities, when a woman is pregnant, do we take responsibility for her? Do we care for her? I've spoken, in the project we did, we understand that the power of the mother-in-law or the husband, these are issues in the country that are outside of government. So a woman who is pregnant, and in some northern states we did the work in, before she can even go to a hospital or clinic, she has to seek permission from her husband or from her mother-in-law to even go to a clinic, even if there is one available. So we know that we have our own practices, beliefs that we need to confront, discuss, and discount. And we even have the belief that for a person to have a cesarean section, which is a normal clinical procedure that a woman goes through if there are complications, in some communities it's seen as negative. So women will shy away from having cesarean sections even when they need it. And we know that, a cesarean section it's quite a intense health intervention in the sense that you're having an operation done, and sometimes we do have issues with the physicians themselves and the health facility they go to. Do we have properly trained doctors, nurses who can care for women when they're pregnant and about to give birth? So in terms of saying who do we blame, I think there's collective responsibility across all of us in Nigeria to make sure that no woman dies giving birth. And if ever we're in the power to change anything, then we, I think, as a country, should take equal responsibility with government, with communities, with individuals, all taking responsibility and seeing what we can do collectively to change the indices in this country.